Hello and welcome to Noted. Once again, we're with a very interesting guest, and she has something very important to tell us. And listening to her, you'll know why you have an important role to play with this survey and who will participate, who is the target group. We'll find out more from our guest, Dr. Fatma Al Yaqoubi. So, Dr. Fatma, welcome to Noted.
Welcome, Lakshmi, and thank you very much for making this interview and spot the light on this important survey.
This is a very important survey that you're starting off, and it is on TB. So for the benefit of everyone, let me ask with a basic question, what is TB?
Tuberculosis is one of the communicable diseases that it has been discovered a long time ago, since 1881. The bacteria causing this disease has been discovered. And since that time, tuberculosis is still existing in the air and affecting all kind of ages, different nationalities. So no one can escape from tuberculosis if they has been exposed to it. It is one of the top killer in the world. Yearly, tuberculosis can affect around 10 millions worldwide. Yes, and it can kill around 1 million per year from different countries.
I thought it was very well controlled, tuberculosis.
Actually, there are many activities has been going on since many years, mainly by WHO and all the countries to control the disease. But recently, the WHO called countries to and have a strategy to end tuberculosis, actually. The issue is that some of the countries are really suffering of tuberculosis, where the number of cases are huge. Why there are some countries that they were able to decrease the number of cases. Oman is one of these countries where the tuberculosis have been controlled still, but we are considered one of the low incident countries. Our incidence is around 10 per 100,000 in the last, say, 15 to 20 years. Okay. Yet, Oman is adapting the NTB strategy, and they are working very hard and putting lots of effort to reduce even this incidence further.
So what actually causes, if it's still going around with all these precautions in the world, what really causes it? The bacteria?
I mean, what happened is that when someone is infected with tuberculosis and another person come across with that person in a closed space.
Yes.
Yeah. Tuberculosis is transmitted by air. I mean, if you sit with someone who is coughing, having tuberculosis, and for some time, the bacteria can be transmitted from that person to the other person. And then the behavior of a different person is between getting asymptomatic infection that has no symptoms, but the bacteria remain in the lungs for a long time, or have active disease and the patient has start to have, symptoms like cough with sputum with the blood, fever, night sweats, and losing weight. So it varies. Of course, the improve in the housing, reduce the crowdness between, improving the poverty, and the other activities like tough etiquette and avoiding crowd help a lot to reduce the incidence of catching such diseases. Because as I said, there are some countries that they are really endemic. The number of cases is very huge, and because of many reasons, and people are still suffering from this disease.
Now, coming to the survey, KAP survey, can you tell us more about that?
So as part of our strategy in ending tuberculosis, we wanted to know what is the knowledge, attitude, and practice of the people in the community from different nationalities towards tuberculosis. So we thought to do this survey to understand well what people knows about tuberculosis, how they are practicing if they have the disease, and what are, for instance, the sources of information that they are using to know more about the disease. This is very crucial. I mean, if you are planning a strategy or you want to improve the service or you want to reduce the incidence, because it will help a lot to find out how to reach to people and how to change their knowledge. If they have wrong information, then you need to know exactly what are these wrong information, how to correct them, how to reach to these people, and what are the best resources so people can utilize them and find out the correct information. And that's why we have decided to do this CAP. Actually, it started from last week, and we are still continuing on this survey.
So how is this survey conducted?
Yeah, so around telephone numbers has been chosen randomly across all the nationalities, Omani, non-Omani, and within the non-Omani with different nationalities from across all the governorates, and the age group is more than 18 years. So as I said, these telephone numbers has been chosen randomly to give you a real indication what is the people know about it. So what we are going to do, there is a group of people who are participating with us from Ministry of Health that they are going to call these chosen people. They will ask them few questions. Of course, they will take a verbal, consent from them and asking them after introducing themselves to ask them whether they would like to participate or not. And we acknowledge really people to participate. Then there will be a set of questions that is going to be asked. And no matter, it doesn't matter. I mean, if you don't know many information, that's fine. We just want to know the reality. What do you know about disease and how it is transmitted and how it is, treated and how it is prevented as well. So just we'll have these questions, and then that's it. And at the end of the day or the period, we are going to analyze this data, and we can put plans for health promotion.
The languages, the questionnaires are, is it only in Arabic and English, or do you have other people speaking different languages?
The language of the questionnaire is Arabic, English, and Urdu as well.
Okay, so that is the variety of languages we have. And the typical questions you said is, what is TB? Do you know how it's being transmitted? And what is the treatment?
It's like just a few other questions, which I don't want
to help now. Okay. Around this. So at least you got 3 questions there. Okay. One last question before we leave you, because you're an expert when it comes to respiratory infections. A day such as this, the dust, we're going to see a little bit more, I think, of the dust for a few more days. So is it harmful in any way? Should we take precautions? Or what would you say between this transitional stage between the winter and summer? What are the precautions we must take?
Actually, it's a natural phenomena that occurs between seasons. So it is not directly related to health in terms of infection, but usually at this transitional state, other acute respiratory infection can also happen. So yes, maybe people who are allergic from dust should avoid, exposing themselves to such weather.
Okay. Otherwise, you do see cases because of the weather change or the temperature from a cooler time to the summer. Is a time for respiratory infections, would you say?
Yes. Yeah. Like a common cold and other respiratory infection, it happened during this time. Yeah.
Yes. So we just pay attention and stay healthy. Thank you so much.
And COVID pandemic, actually, it's better to stay home and avoid crowd, and this will help us also to control the spread of COVID itself and other respiratory infection as well.
Very true. And I was just thinking, looking out through the glass today, all the more reasons people should be wearing glasses while outdoors and being in crowds. As of now, we're alone in our own 2 rooms, so we don't need masks. Thank you so much, Dr. Fatma Al Yakubi. Hoping to meet you again and have another chat with you on maybe different topics, especially COVID-19, which still continues to be on the top of the agenda when it comes to health.